everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Dan Greenleaf, the CEO at Modivcare. Dan, how are you today?
I'm doing great. Very nice to see you, Jared.
I'm excited to have you on here. I think we should dive right into it. If you don't mind, I'd love you could tell the audience a little bit about your background, and then we'll talk more about your company.
Yeah, so this is my sixth CEO job, and uh, I've been involved in biotech. I've been involved in home infusion, and this is really my first, if you will, foray into a social determinants of health company. And have done private and public. Have a master's from the University of Miami, undergraduate from Denison. I grew up with a couple parents that were very service oriented. My father was a military officer, and my mother was a teacher of disabled children. And that's, frankly, if I look at my career trajectory and the things I've gravitated towards, a lot of it has been where I feel like the best use of my time, talents, and treasures could be applied. And that's, I've always looked for things where I felt like I could make a difference in people's lives. And of the six opportunities I've had, this is, I think, the most incredible in terms of the types of things we're going to be doing, particularly at the zip code level.
Now, whenever I have a guest on the podcast, Dan, I focus on three initial things in my questioning. I
Mm-hmm.
always want to know the why, how, what of the company. So, you
Mm-hmm.
talking about your background and things that you care about, I'm sure ties into the why of
Yeah.
the company. That always happens. But can
Mm-hmm.
you go into tell us a little bit more about the why of the company as a whole, how things work, and then for anyone that's unaware of the company, what you do exactly?
Yeah. So the why we're in existence is because zip codes are the single most important variable in the predictor of outcomes. And that's wrong. And not genetic codes, zip codes, and adjacent zip codes that have life expectancies 15 years less. It's just unacceptable. And so the why we're in what we do. That's why we're involved in non-emergency medical transportation. We've got 30 million members, or 9% of the U.S. population that we manage. Why we're involved in personal care, which is activities of daily living. Why we're involved in remote monitoring. Why we're involved in meal delivery is because we are absolutely committed to addressing the zip code issue. And I think COVID has highlighted this. COVID has highlighted the vaccine deserts, the pharmacy deserts, the food deserts, right? The broadband deserts, which is, again, something that's not well understood. But we're the Y company, I would say, and the Y company in terms of addressing these zip code issues.
And this wasn't one of the things I was thinking about bringing up, but I'm curious
Mm-hmm.
because you mentioned the pandemic and when you're talking through some things. How have things changed for the company? I don't think we're post pandemic yet,
Yeah,
but we're
that's correct.
definitely, I would say, I mean, we're in a better spot than we were 2 years ago, right? How
Correct.
have things changed for the company as a result of COVID-19?
Well, we've done uh, five or six acquisitions over the course of the last year. And a lot of that was driven by what we saw during the pandemic. And so, for example, we delivered over 2 million meals to, we partnered with community-based organizations, but there's massive populations of people that are just underserved. So we launched a meal business, and we also realized that um, that the remote monitoring piece of where people are staying in the home and not having as much access was an important component of the healthcare model going forward. And also, even our whole move in the social determinants of health, I would tell you, has largely been driven by the fact of what we saw during COVID. And again, it gets back to pharmacy deserts, vaccine deserts, the level of inequity in healthcare, um, the the I think the monumental kind of uh, uh, the monumental things that people have to overcome to get care. And so I think, for us, it's emboldened us, and it's made us, I think, even feel more passionate about our mission and the importance of what we get to of what the privilege of what we get to do every day, and really trying to get to a point where we're doing everything we can to make that member experience exceptional. We're spending $100 million on tech this year. We're a healthcare company, but we're a tech company too, because we also know we need to meet the member where they are. So I would also say this notion of high tech and high touch is not going away in healthcare. There's these, again, with all due respect to the teledocs of the world, I think they will play an important role, but I absolutely believe that the high touch piece of this isn't going away anytime soon. And particularly with the patient populations that we serve, that oftentimes don't have data plans, that don't have Wi Fi in the homes, that use flip phones. Yes, they might have an iPhone, but it's probably most of the time suboptimized.
Now, you've mentioned this a little bit, Dan, but I want to dive more into it because yeah, it's very important. Can you kind of outline some of the opportunities, the significant opportunities you're facing with the company in terms of addressing health equity? And then you already gave us a few ways that you're resolving, issues with health equity. But maybe
Mm-hmm.
you could, if there's anything else you want to tack onto that. I know you mentioned meal, the meal structures that you were putting together.
Mm-hmm.
Anything else that you can share would be greatly appreciated.
Well, so so transportation's a big one. I mean, access is massive, and um, and so what we're trying to do on that front is, I would tell you that the business was run very much. Um, I would describe it as analog, and we've moved the company to what I would describe as a digital experience, and we want to make this experience as frictionless for the member as possible, so that we mitigate the disruption. So I think the technology investment of that 100 million, I would say 90% of that is in the NEMT space. So that's one area. We talked about remote monitoring, right? That includes I fall and I can't get up. That includes vitals monitoring. That includes medication management. All things that are very important to our populations in terms of predicting, if something's going to get worse for them. We also we mentioned a meal delivery program, but also personal care. Because personal, we believe that ultimately that caregiver, if if we allow that caregiver to work on the upper end of their license, they can add a lot more value than they've historically been able to do in terms of the care of those members. And some of that's technology improvements, and some of that's what they're able to if you will gather from their in-home visits. But I do think there's a whole population of people that just haven't been empowered at the level they could be. And then ultimately what we're moving towards is value-based care. And we've got a value-based care initiative going on with a large payer in the state of Illinois. And I think we're going to have some very interesting data that's going to come out about when you provide these four areas of service, that actually the outcome of the patient is going to be better, whether it's quality of life, whether it's reduction in ER visits and reduction in hospital admissions.
It's these are definitely conversations too. It's taken us a while to have them more often,
Mm-hmm.
but it definitely feels like these issues that you're addressing, they're still probably not getting the screen time that they deserve. But I don't know if you would agree with this, but it seems like we're talking about them at least now more than ever before. Can you kind of talk us through maybe why you're seeing that to be the case?
Well, I would, again, this is all hypothetical, Jared, but I listen. I think we've all dealt with social isolation. You look at the mental health, issues that are, what our mental health issues up, 25% since COVID started. So I think all these things that maybe others had experienced, I think also, I think we all experienced kind of difficulties getting vaccines, right? Oh, we got to, and imagine, this is one of the other things people don't appreciate. What if you were an hourly worker and you have to get two vaccines, and those vaccinations kick your butt for 5 days? It's a real problem, right? So they're like, well, what's my trade-off? So I think there's a lot of this. So they went J&J, and we found now that J&J product isn't as efficacious, either the Pfizer or Moderna. But I think a lot of there's I think we have a visceral kind of experience with a lot of the things that others had to deal with, and the difficulty that that creates. And I think it is. I also think that I think I would say that it's not a political statement, but when I listen to the Biden administration talk about their healthcare plans, the first thing out of their mouth was social determinants of health. So they get it. They get this zip code issue. And I think there's an awareness in the administration that's different. And again, I think you have people like myself that are out there talking about this every single chance they get, and actually are doing something about it. Because again, we manage 30 million members, 9% of the U.S. population, and these are patients that have been underserved, and we've created barriers to care that we're going to address that are not clinically based. I'm not saying clinical doesn't matter, but I think we've missed this whole piece of the pie, which is the supportive care piece.
My last question for you, Dan, and thank you for sharing everything today. Really appreciate it. Is if you could make a change in the world right now relating to health equity, what would it be? Now, I know this is tough, right? There's so much you probably want it, but one thing, what would it be?
Zip code. The zip code isn't the single most important predictor of health outcomes, and we should all be upset about that.
Well, I what I would like to do, Dan, too, is to have you come back on at some point, and we can talk about these panels that we said we'll bring in others in the space. That share your viewpoints. It'd be great to kind of hear you two or you three or you four kind of go through the zip code issue and other issues that we discussed here today. But like we can even go into them in greater detail. This is the first time you've been on the show, so we like to keep it short and sweet,
Yeah.
get people to that that have heard about you to hear from you again, that
Yeah.
haven't to hear from you for the first time. So thank you so much for your time here today. Really appreciate it.
Yeah, Jared, thank you. Thank you for affording me and our company this opportunity.
Absolutely. Thank you.
Take care.